let's go for next guest speaker. Thank you, Gail.
Okay, Gail, before we move on, it would be great if you could share your link to your book in the chat, so anyone who wants to know more can find your book easily, because that sounds like an excellent resource. So let's move on to. Oh, sorry.
I'll move it on. I don't know how to share it in the chat because I don't even see a chat, but Lily can share it with you when you want.
Fantastic. We'll find it. We'll find it. So our next speaker, Dr. Farzaneh Golboni, are you there? Can you switch your camera on so that we can see you? Ah, fantastic. Hi, you're so welcome. So Dr. Farzaneh is a faculty member of the Ministry of Health of Medical Education in Iran. She is a board member of the Scientific Association of Midwifery in Iran and an ICM member since 2017. Farzaneh, we are so pleased to welcome you to join and share your experiences of midwifery practice in Iran. And I hand over to you.
Hi, Kate. Hello, everyone. Happy International Day of Midwives. I'm Dr. Farzaneh Golboni, faculty member of Ministry of Health and board member of Scientific Association of Midwifery. ICM member from Iran. And I want to tell something about the midwives activity during the pandemic in Iran. And as you know, during the last year, we saw everything change around the world. And I think Corona proved much more than connected, proved us we are much more than connected that we imagine. And the role of the midwives in the pandemic was really commendable. In Iran, as in many other countries, midwives had an important role to provide safe and best care during outbreak alongside with other health professionals. With all bad effects and all loss during this pandemic, our experience showed that much more good collaboration between health professionals against COVID-19. And we also saw more friendship and solidarity between health professionals. The role of nurses and midwives became more projected than before. And last year, Iranian midwives performed more than 17% of deliveries in all settings. And this is a good data that show the important role of midwives in health-related data. The ICM theme for 2021 is the follow data, invest in midwives, emphasizes the role of midwives in health-related data. So my friends, I provide you some data of midwives' activity during COVID-19 outbreak in my country. Since the outbreak of COVID-19, midwives have served in 3 different areas, including primary health care, and hospitals and call centers as a consultant. In primary health care level, collaborating with other health workers, more than 15,000 midwives have served at various levels of rural and urban primary health care facilities, district health centers, and maternity facility centers. In addition to routine pregnancy care and routine tasks, working in 17 hours health care centers, that calling centers, and consult with mothers and other peoples who have any concern. They participated in telephone screening of COVID-19 and for more than 78 million of Iranian people. They have screened more than 500,000 of pregnant mothers in 2 rounds of telephone and face screening, and have done follow-up more than 4,000 suspicious cases in this level. And the other level in hospitals, we have more than 17,000 midwives working hospital across our country. They are working in the labor, postpartum, high-risk maternity, neonatal and NICU wards. As all hospitals have been accepting pregnant unconditionally, so all midwives have been involved during the current pandemic, and more than 5,000 of these midwives, around 30%, have been active in COVID-19 referral hospital during the first 2 months of outbreak. Nearly more than 1,000 midwives have also volunteered help other health staff in another wards in referral hospitals. Since the beginning of outbreak, more than 72,000 pregnant mothers visited at referral hospitals, and more than 200,000 of mothers visited in non-referral hospitals, inpatient and outpatient, and 885 cases out of the total visited cases were suspicious to COVID-19. In addition to the routine task of midwifery, such as including performing vaginal delivery, postpartum care, and they have also taken care of mothers who were considered as suspicious and or confirmed cases of COVID-19 during labor time and after that. So, and after the next area that we work as a midwife in Iran, telephone-based midwifery services as a consultant. At the same time, telephone-based midwifery services or midwife consultants started working from beginning of outbreak. And they were active answering inquiries concerned of people, especially pregnant and lactating mothers, with the aim of reducing the unnecessary visits to the health center and increasing the people and mother awareness and the knowledge and reduce the level of anxiety and stress during this outbreak. Faculty members and other staffs, midwifery staffs, provided necessary technical advices during 24 hours telephone centers. And so far, over more than 100,000 phone calls have been answered by 600 faculty members and 300 experts. And the number of infected midwives, unfortunately, over 1,000 midwives, and we lost 18 of them during the COVID-19 pandemic. And as a faculty member of Ministry of Health, I think some option for changes and adoption in women care during COVID-19 pandemic is very important for all countries. We in Iran perform some strategies for the better care and the best and safe care for mothers. Preparing national guidelines and risk assessment for staffs, midwives, and in all settings, hospitals, health centers, and other private centers. Self-care and self-isolation is very important part of our strategies. Change layout of ward, entrance and exit of hospitals for mothers, increasing the number of beds for possible COVID-19, medical and emotional support for women and their babies, and 24 hours call center for consulting all people and separate telephone line for pregnant women. I finished my statement, and thank you for thank you for Lilly Center for this opportunity for my presentation. Thank you.
Thank you so much. It's so fascinating to hear your data, and actually, of course, I'm a researcher, so I am interested in data naturally, but that is the theme of the International Day of the Midwife this year, follow the data. So it's so great to hear your data from Iran. That's just fascinating.
Thank you so much.
Does anybody have any questions that they would like to ask? Please do feel free and unmute or type in the chat. Gail, you have a question, please. Well, I think you're muted again. Syed, please, could you help us?
Okay, yes, I'm very interested in how you handled the COVID in Iran, because right now I'm in Belize, which is a very developing country,
Yes.
and I also know how they handled them in Canada. But did you allow the mothers to keep their babies with them in Iran? Like the baby stayed with the mother even if she was positive?
Yes, in our new guidelines, keeping mothers and babies together, and attachment, first attachment is very important, and we have a separate guideline for skin to skin attachment, and this is a rule in our wards.
Okay. So the babies got to stay with you. They didn't get separated. And then because some countries are doing, like, you can't breastfeed your baby, you can't keep the baby. It was awful, just awful.
No. This is we have a separate guideline for skin to skin touch.
So they can do that. They can have skin to skin touch. No? Yes.
Yes.
And they can breastfeed their babies.
Yes, breastfeeding.
Oh, you're wonderful. You're wonderful.
And they are not separated.
Good.
They are
Perfect.
never separated together.
That's wonderful. That's very nice to hear. Thank you.
Thank you so much.
How is the pandemic going in Iran now? I've not heard about this. We are improving in the UK, but I wonder the situation around the world.
Unfortunately, we have not in good situation, because we have 4 peaks of this outbreaks, and we have the bad situation of the coronavirus and new type of virus, such as Indian type and British type, and another type of yes. And Wuhan type. We have more type of this virus, and we challenge with them, you know. And unfortunately, we don't have enough vaccine for public vaccination.
Oh.
And
tough.
Oh, sorry. Please, Gail, so sorry.
I just said that's tough if you get all these variants, but oh well. We midwives and doctors just keep on and right?
We have to.
Yes, we do, dear. Oh, you're wonderful. Thank you.
Thank you so much.
Obviously, the pandemic has brought so many negative aspects, but it sounds like the telemedicine aspect has really, you've managed to use that successfully in Iran. I wonder if you could share the lessons that you've learned about telemedicine or whatever else you've learned from practicing during this pandemic?
Sure, and I sent our experience to Leila and our package and our guideline, and share to all of midwives around the world that they want to this day.
Thank you so
Thank
much.
you.
I will share with everybody.
Thank you so much, Leila.
Thank you so much, Doctor. It's very fantastic. We are so proud of you.
I wonder if we should move on to our next speaker. Thank you so much. That was just fascinating.
Thank you.
Okay. Thank you, Dr. Golboni, and for your beautiful presentation. You are Shiro of Iran, and I know very nice digital midwifery plus telemedicine is going on in Iran. We have started many online prescription, and our health centers, Iran Ministry of Health and Government started many online and distance checkup for all of Iranian clients. I will share with you later with all details. Okay, let's go for next speaker.